can I have surgery if I will not accept a blood transfusion? So this, I guess the answer is it depends on what surgery. So minor procedures, mole cysts, all the stuff we do in the clinic under local anaesthetic, absolutely no problem at all. We have just recently added this question to our front sheet. So it might look a bit unusual if you're coming to have your mole removed and there's a question there saying, would you accept blood transfusion? It's not really for you. I can't really make it so that it only goes to certain people. I think it says if appropriate or something like that. But it's really for people having the general anesthetic procedures. And the problem with that is the hospitals. So people, and the classic example is the Jehovah's Witness patients who will not accept a blood transfusion. And the problem is with the hospitals. I have operated on Jehovah's Witness patients, and I very, very rarely need to give a blood transfusion to anyone. And if I ever did need to give a blood transfusion to anyone in the past, it would be because they've lost a bit of blood during the surgery, they're feeling a bit weak and wobbly, and you'll say, look, you'll feel a lot better with a blood transfusion. Your blood count's a bit low. You feel a lot better with a blood transfusion. Within an hour or two, you'll feel much better. If you don't want to have a blood transfusion, you can leave it, but it might take several months for you to get better and to build up the blood in your body. So so those are so if you're in a position there to say, well, no thanks, I don't want it. I'm going to rather wait until I feel a bit better. So that's it's very, very rare for someone to need a blood transfusion intra-operatively, so we can't actually talk to them, sort of thing, which I think is the concern about people who say, I don't want a blood transfusion. Right? And so that's extremely rare for any of the ops that I do. So I have got no concerns about operating on patients who will not accept a blood transfusion, because, as I say, it's extremely rare to need one, and when you do need one, you can usually have a discussion with the patient. And if you say, look, I'm happy feeling rubbish for 3 months while it gradually builds up my blood count, then you say, well, that's fine, then we won't give you a blood transfusion. So I'm comfortable with operating on patients who will not accept a blood transfusion. The problem is the hospitals, and it's got worse since COVID. So we have done Jehovah's Witness in the past, and it's a little bit of a palaver with a form that you have to fill in and sign a particular consent form. Is getting more difficult now, and certainly some of the hospitals I work in, just like blanket no if you won't accept a blood transfusion. So it is getting more difficult to operate on patients who say they for general anesthetic cases, so breast lifts, tummy tucks, breast implants, these sorts of things. The patient, if they don't accept the blood transfusion, even though I'm saying, look, you're fine by me, I'm okay with it because you're very unlikely to need one, and if you don't want one, that's fine. But we can't actually get into the hospital. We can't actually fill the booking form in, and they won't accept it because they have these policies where they won't take people who won't accept the blood transfusion. So that is the problem. So can I have surgery if I not accept the blood transfusion? It depends on the hospitals. There's one hospital where there's a form you have to fill in, and it can go to the kind of medical board to see if they'll approve it. So it's not a definite no. It's a definite no with some of the other hospitals, but there is one that will take the form, but what happens on the results of the form is up to the hospital, really. So it's really something that we need to put to the hospital rather than me saying a yes or no, because I'll say a yes basically, but I can't do it if the hospital won't